Alright, I have checked my orders. I have checked my baby's birth history. I have checked my baby's vital signs. I have checked my baby's weight. I have gone in, I have provided privacy, I have washed my hands, and I have put on gloves. So first thing I'm going to do with our little baby here is I'm going to check the length from the top of the head to the foot, and it is about 30 centimeters. And then I will check head circumference. Which is about 27 centimeters. And then I will check chest circumference. Which is about 23 centimeters. While I am here and measuring, I will measure the baby's nipples, and they are about 5 millimeters. I note that they are not engorged, and there's only 2 of them, and they are within defined limits. So I am going to go over baby's general survey. Baby has both arms, both legs, 10 fingers, 10 toes. Baby can move arms and legs good. Muscle tone is present. Range of motion is present. Baby is crying good, just like what we like to hear. I will move on to baby's skin. There is some vernix on the skin, which is normal. I note some nugo on ears and shoulders, which is normal. There is no petechiae present or Mongolian spots or erythema present at this time. I will move on to baby's head now, and I will palpate the anterior and posterior fontanelle, and neither are sunken in or bulging. They both feel flat. There is no molding noted, no cephalohematoma present, and there is slight caput present from birth, which is normal. I will move on to baby's face, which is symmetric. I note their eyes are symmetric. This baby has blue eyes. I note there is no conjunctiva present around baby's eyes. I note perla. Baby's eyes are equal reactive to light. I will move on to baby's ears. There is no tagging present on baby's ears, and the top of the ear and the outer canthus of baby's eyes are even, which means there are no abnormalities present at this time. I will move on to baby's nose, which is symmetric. Both nasals are patent bilaterally. I will move on to baby's mouth. I will just stick my pinky in, and I feel that the soft and hard palate are both intact. And while I'm in there, I will check baby for Epstein pearls, and there are none noted. I'm going to move down to baby's neck and clavicles, and I'm just making sure that the clavicles are intact and none broke during birth, which seems they are fine within defined limits. I will move down to baby's chest. Baby's chest is symmetric. There is no concave or barreling. Moving on to baby's abdomen. Baby's abdomen is not distended. I note the cord has 2 arteries and 1 vein. I will go ahead and listen to baby. And I will listen to baby's respirations and apical heart rate for 1 minute full apiece. And any type of crackles or murmurs present are normal within the first 24 hours of delivery. I will listen to baby's bowels, and if baby has eaten, then there will be bowel sounds. If the baby has not eaten, there will not be any bowel sounds. I will move down to baby's genitalia. um, baby has been voiding, has peed, and it has produced meconium. There is no discharge noted at this time. Labia is covering clitoris of female. For male, meatus is center. I can palpate the testes. They are down, and the rugate is present with the scrotum. I am going to turn baby over now. And there is no spina bifida present. Baby's spine is within defined limits. And while I am back here, I am going to perform the anus wink and make sure that baby's anus is patent, and it is. I am going to turn baby back over. And I am just making sure again that all extremities are moving within defined limits. Range of motion is good. I'm going to move on to the reflexes now. We have the moral reflex, which is the startle reflex. I startle baby and baby reacts. You have the tonic neck reflex. Baby's head turns one way, and then that arm goes out, and the other arm goes in. You have the rooting reflex, where I touch baby's cheek and baby turns head towards my finger. You have the sucking and swallowing, which I will test later on when I see baby feeding with mom, and make sure those are present. I will check the palmar grasp reflex, where baby grabs my finger with her fingers, and then I will check the plantar reflex, where baby grabs my finger with their toes. Both are present. While I'm down at the feet, I will check the stepping reflex. I will tap the baby's foot, and the other foot will rise up like baby is taking a step. While I am down here, I am going to check the Ortolini test, and I will make sure the hips are not dislocated, and I will make sure baby's feet are not clubbing. And then before I leave the feet, I'm just going to rub up and to the side and make sure baby's toes fan over with the Babinski reflex. And then for one more reflex, I am just going to rub the baby's side, and the baby will curve in as I rub, and that is the Gallant reflex. And I believe that is everything.